Late Night Health continues. I'm Mark Alyn. We're going to spend some time with Dr. Hannah Liu, MD. She is the CEO and creator of OncoGambit. It's a new website. It's just launching now. And this is designed for people who have been diagnosed with cancer. Dr. Liu, welcome to Late Night Health. How did you come up with the idea for this website?
I have been practicing medical oncology for more than 20 years, and my specialty is in breast cancer. And throughout my career, I noticed that a lot of time patients come in for a second opinion about their treatments, and they're very scared, anxious, and worried. And usually they've been waiting for 3 to 4 weeks, and sometimes have to drive hours, to get to where we were, and get to be seen. And so I understand the need for patients to make sure, to want to be sure that the treatment they get will be the right one for them. Also,
I have to ask you something, because we've talked about it here on the show, and that is the waiting. If, God forbid, somebody comes into your office and you say you've done tests, you've done a biopsy, and it is indeed cancer, breast cancer.
Right.
Why is there a waiting period? Why does it take so long to book the ER and all that? Because at the same time, doctors are saying you got to get it taken care of fast. It doesn't make sense to me, that waiting period, which also adds additional stress on the patient.
Right, but there are two scenarios here. If it's an emergency, then you will get treatment right away. It's unlikely cancer. It's unlikely an emergency. And you just have to find a spot. And usually most people, go in with weeks and weeks already fully booked. So you got to find the next available slot, right? Because everybody's on the list have cancer too.
Right.
So certainly, unless it's emergency, by that we mean, you're bleeding, you can't breathe, infection, then those that take priority. In those cases, they get admitted straight to the hospital, and you will do that as an inpatient. But as an outpatient, you just go to the next available appointment.
Got it. And again,
and it doesn't compromise. It's yes, it can be weeks, but in a sense, it's not going to endanger the patients.
Because that's what I always think about. Thank God nobody's ever said to me, you have any kind of cancer. But at the same time, I can imagine I'm such a baby when it comes to personally. They said you have a hangnail and we can't take care of it for a month. It would drive me crazy. Do you understand?
I know.
Right?
I'm the same. I'm probably the worst patient.
Doctors are always the worst patient, other than talk show hosts. So, OncoGambit is designed to help patients find a second look at the condition and offer different options for treatment.
Yes. So we this is a very user-friendly website. It's built to educate the patient about their best treatment option at that time. So we build to answer the question, what is the best treatment for me to ensure my survival? So do you know anything about the guidelines for medical oncology?
Me personally, no.
Okay, most of your audience will not as well. So let me explain this.
Sure.
So if you have cancer, you will need to meet at least with 3 doctors, right? The surgeon, if it can be operated. The second doctor will be the radiation doctor, which can, if you need it, for radiation therapy. And the last one is the medical oncologist. So this one is the one that will give chemo or pills, or the pills to fight cancer. So those are the three doctors, the minimum of three that you will meet. The point is that this application is built only for medical oncology, because in medical oncology, there are so many treatments going on. And as a result of that, every year we have thousands and thousands of clinical trials, right, published. So there is so all of the physicians, we form a multiple national guidelines that's represented by 1,100 cancer experts. And they sit down every year to go over the data, all the trials, and that show, okay, this treatment is better than the other one, and decide which one of that we agree that will be the best one for now, and then we'll recommend it as the standard of care. So, for example, the standard of care for breast cancer in 2016 will be different than the one in 2015 or 2014.
Because it keeps changing. It evolves.
Exactly. So the reason it becomes a newer standard of care, because that new treatment or the new combination of treatment provide you a better survival than the one before. So if you're a cancer patient, it's important that you should get the best one, don't you think?
Absolutely. Has, over the last, say, 10 years, and you say you've been practicing 20-plus years, so you started, you were like, what was his name? Hauser.
Neil Patrick Harris.
Yes, whatever his... you sound like you started practicing at 14 or 15, doctor. And
Thank you.
You're welcome. Has cancer treatments improved? In other words, we have more people coming down with a variety of cancers, including more breast cancer than ever before. We've been doing a lot of work with the Komen Foundation, at least making people cognizant of a variety of treatments, not only mammography, but also medical thermal imaging. There are non-traditional routes to fight cancer. We've talked about that. But has cancer, the cure rate, has that gone down as cancer increases? The number of incidents increase.
Okay. So for breast cancer, we improved over the last 3 decades. We improved the survival from 65 to 95%. So definitely, yes.
It's no longer a death sentence.
Improve. Right. And we are changing cancers into something called chronic disease. There's still cancer that we still struggle, like pancreatic cancer, lung cancer, so forth and so on. But overall, our goal, and I'm pretty sure I will see that during my lifetime, that we be able to change cancer to the chronic disease like diabetes, hypertension. You will constantly to be on something to control cancer, but you don't die from it. Do you understand? So,
right.
Yes, there are a lot of improvements in cancer treatment. In terms of the incidence, you discussed, it seems like, there are more cancer. Actually, the incidence of cancer has been stable. The reason that the overall number of cases are going up because we are aging. The aging, getting older is number one cause of cancer. After so many times cancer cell replicate, it starts making mistakes, and the mistake causing cancer. So, we used to, in the Renaissance days, right, survival is about 40 years old. And now the survival, the longevity for the U.S. is 88 years old for women and 86 for men. So as you live longer, you have a higher chance of having cancer.
How does OncoGambit help increase older patients' chances for survival?
it's mentioned before. This is how you use our system. So you see your doctor, and it says this is what you need to be on, right? So we automate. This is the software that will give you the recommendation that based on multiple national guidelines. So we ask you to input. So when you get in, we have like pages and pages of educations about each cancer and what's important to determine the treatment from that cancer. Then you answer a few questions. One is about yourself, like your age, your gender. The second one is about the biology of your cancer, and so we explain why. And these you can get from your doctor, or you can get it from your from the pathology report, most likely from your doctor, and the stage of your cancer. And after that, you're gonna get a very specific report, very personalized the treatment that based off 2016 for this stage, and with these features, this is the best, right? Then you can have a discussion with your treating doctors and at the higher level. And that's what we aim. We aim for the understanding, education. And in addition to that, we also provide cancer survival care. As you see, as we improve the survival, more and more cancer patients will be survival. We have more than 3 million today for breast cancer in the U.S. So we are also give big on diet and exercise, right? We give very specific recommendation. You need 300 minutes a week of exercise, and like 80% of your diet should be just fruits and vegetables, and those have shown to improve survival and also reduce recurrences, and at the same time. That is also proven, and we have data to show that as well.
And will you expand as OncoGambit, unveils today, as we are recording this interview? Will OncoGambit expand the kinds of cancers and also the treatments to include, I'll say, non-traditional or alternative health, because a lot of people want to try those before they go to radiation and chemo.
Yes, we will if we have evidence for that. So I give you an example. In my practice, I saw a lot of patients came in with metastatic breast cancer, and we have a lot of treatments for that. But they want to try some non-traditional, and one of the treatment a lot of people use called blue scorpion powder. Okay, and it costs like $1,000 for this.
Oh my goodness!
Powder. Yes, and so we did a research, and there was no evidence to support that this treatment helps.
But there are other treatments out there that people have. I mean, and a couple of celebrities have talked about their treatment. Doctor, I am so sorry we're out of time. Thank you very much for joining us. Hold on. I'm Mark Alyn along with Daryl Wayne. We'll be back in just a couple of moments as we wrap up our show today with Robert Clancy from The Hitchhiker's Guide to the Soul. Join us at latenighthealth.com.
The experts at Web.com want to build your business a successful website for free, just like we did for these current Web.com customers.
We've looked at other website designers. There's nobody better than Web.com.
Web.com can build your website in as little as 7 days free. Plus, we'll promote it on all the major search engines. If after 30 days you're happy, we'll continue to provide promotion, hosting, support, and maintenance, all for one low monthly fee. If not, cancel and pay nothing.
If you're in business and you don't have a web presence, you won't be taken seriously.
Call right now and you'll also get a free .com or .net domain name for your new website, powered by VeriSign, the world's leading domain name provider.
No upfront charge for site build, after which ongoing fees apply. Rights to site are relinquished when canceled. Domain included during active service, after which fees apply.
800-489-8751. 800-489-8751. 800-489-8751. That's 800-489-8751.
Attention users of the blood-thinning drug Xarelto. If you took the drug Xarelto and experienced complications such as cerebral hemorrhage, gastrointestinal bleeding or other internal bleeding, or if a loved one has died after taking Xarelto, you may be eligible to get a cash award for your suffering. Call the Xarelto Help Hotline now at 1-800-264-3150. That's 800-264-3150. To qualify for a cash settlement, you must file a claim before the deadline, so don't miss your opportunity for a cash settlement. Call 800-264-3150 now for a free, no-obligation consultation. Our call center is open 24/7. So if you took the drug Xarelto and experienced cerebral hemorrhage, gastrointestinal bleeding, or other internal bleeding, or if a loved one has died after taking Xarelto, call the Xarelto Help Hotline now at 800-264-3150. 800-264-3150. That's 800-264-3150.